Dr. Michelle Hauser, chef and medical doctor, clinical associate professor of surgery and medicine at Stanford University School of Medicine. I did my culinary training long before becoming a doctor at Le Cordon Bleu and did my medical training at Harvard. I've also trained in epidemiology, which is the study of disease, and nutrition at Stanford, and am board certified in internal medicine and lifestyle medicine. I currently practice the majority of my time in obesity medicine at Stanford University and also for Veterans Affairs. And for over 2 decades, I've been teaching cooking, first to the general public, and more commonly now, I'm teaching healthcare professionals how to cook as a way to get them interested and engaged in helping people make healthy diet changes that most importantly are delicious, first and foremost. So what this has evolved into is something called culinary medicine. And culinary medicine is an evidence-based field that brings together nutrition and culinary knowledge and skills to assist people in maintaining health and preventing disease by marrying together healthy eating and appropriate medical care. Diet is incredibly important. It's been identified as the single most important risk factor for death and disability in the United States and has a major global impact. So on the flip side, focusing on health and improving health, making healthy dietary changes is one of the most important things that we can do to live long and healthy lives. But of course, humans are really drawn to delicious food, right? We don't crave fiber, we don't crave vitamin D, we crave juicy, sweet, savory, salty, we crave beautiful colors, we crave foods that smell amazing. We crave the things that we grew up eating in our childhood. And so we really, I think, if we're going to be effective at helping people make dietary changes, we really have to focus on those things first. And, by the way, if we can make that healthy as well, then that's the way that we're really going to change behaviors. This course is first and foremost meant to celebrate food and flavors and colors. As you go through, the goal is to come out with a wide variety of cooking skills and techniques that you can use to make anything that you would want to enjoy at home. The emphasis is really on things that are approachable, affordable, and that you should be able to accomplish in a busy lifestyle. So anything that there is a more complicated technique shared, it's really for the knowledge and background, but I'll always give you a simpler, quicker, easier way to do that. If there are ingredients that might seem unfamiliar to you, it might be that they're still widely available and you should just get in there and try them. Anything that might be a little trickier to find, certainly you can omit, or I'll give you alternatives that you could use. I'd encourage you to work through the course from beginning to end if you can. There are multimedia options, there are videos, there are print materials, and certainly all the recipes that we use. In this course, recipes are there and available because I find, especially for beginner cooks, they're a great safety net. But they're also a nice structure or pattern that you can follow that you can make modifications from. So you should certainly feel encouraged if it's anything that's not a baking recipe or where I specifically say it would be good not to modify, then you should definitely go ahead and switch out spices, switch out vegetables, switch out your beans or grains that you want. We also highlight in the course working across a spectrum, so trying to move from wherever you are to a healthier version of a diet that you feel is sustainable, comfortable, and enjoyable. And the speed at which someone would make those changes will vary from person to person. So I try and give modifications throughout as well, so you can really make this something that tastes good and feels comfortable and enjoyable to you.